Today is March 18, 2014, and this is the first in a series of teaching videos for new medical students who are beginning their psych rotations. The software we use in this office is practicefusion.com. One word, practicefusion.com. practicefusion.com. And the practice name is this, my first name and the last name. Typically, it would email you your user ID and your password. So let me type in the password here. Alright. So as soon as you log in, always go to charts here at the top. That's the patient chart. And you can type in the last name of the patient. Let's assume it's a test patient for HIPAA reasons. Test patient. This is just a test patient. Always use SoapNotes for all your notes. Let's assume we're doing an initial evaluation. It would be start chart note, SoapNote, and we will have today's date. Always remember, if you're doing your rotation, to change the scene by to my name, because I am the actual provider. You might just be scribing for me and that's it. You remember, you're not allowed to sign off on any notes either. So let's assume this is a new note for today, and this is an initial visit. So chief complaint may be initial visit for evaluation of anxiety and mood swings. Of course, you have to put the patient's height. Let's assume it's 5'8". Let's assume the weight is 180. It will calculate the BMI for you. Let's assume the blood pressure is 120/80 and the pulse is, say, 70. And then you start your evaluation. Under the subjective, it would be identification, this is a 25-year-old African American female who is raising 2 kids with limited support from their dad. She is currently unemployed. has limited support from her best friend, Caroline. Chief complaint: I feel overwhelmed. History of presenting illness. It would be something to the effect, assuming I was typing, that patient was her usual self up until the age of 18, when she observed frequent irrational mood swings that meets criteria for either a manic episode or hypomanic episode. And you can go ahead and describe it with or without psychotic features. And there's no 2-week period where she will be psychotic without mood symptoms. In other words, you ruled out schizoaffective disorder. She also noticed comorbid panic episodes with or without agoraphobia. There is no history suggestive of trauma and PTSD. And then you could go into the past psychiatric history. She's been treated before for bipolar disorder and responded to Seroquel. She was also treated with Xanax for anxiety, which helped her. Medical history significant for the absence of thyroid problems, no adrenal gland issues, and she's not really on any medications that can explain her symptoms. Also, her symptoms are not due to bereavement. Allergies, no non-drug allergies. Substance use except for tobaccoism. She denies use of alcohol or illicit drugs. So her symptoms cannot really be explained by drug use such as cocaine or marijuana. Family, social, and developmental history. There is biologic marker for mood disorder and anxiety disorder in her sisters and brothers who have both bipolar disorder and panic disorder. Psychological factors include feeling helpless and hopeless. Social factors include the deficits in primary support. In terms of her mental status exam, which will be under observation, we do have templates under frequently used templates up here. You can select from general and physical. In her case, she was both anxious and depressed at the same time. This is a template that we have. We also have templates for just irritability, just anxiety alone or depression alone, and so on. There's one for psychosis and there's one for MRDD. Assessment. Patient is either worse, better, or the same, or maybe she's still symptomatic even though she's improved. In her own case, she's worse. And diagnosis, you can always add diagnosis here. And when you've cleared with Dr. Ike, in her own case, I'll probably give her bipolar disorder moderate without psychotic features and panic disorder with agoraphobia, as well as adjustment disorder with mixed anxiety and depression. You can add diagnosis here. Typically, you can put the numbers here, or you can just type it in words. And you click add. If it's a follow-up patient, you will see her existing diagnosis, and you select usually 4 if he was there previously, and add. And the plan, we have various power plans that typically would say your treatment goals, the therapies you plan to offer. It's all detailed in here. If you click on one of these power action plans here, you'll see the details. And of course, you add her medications. Typically for all new patients, we recommend that you do baseline labs. Ordered. This will include thyroid function, CMP, CBC with DIF, and the drug screen. You save that, save record, and of course you add weekly counseling to address coping skills and catastrophization. For instance, in this case, we already added this one, weekly counseling for self-esteem or whatever it is you want to address. Then, of course, any new medication you want to add, like Xanax or Seroquel, you can add it here. And of course, you have to finalize. Under finalization, you have to select encounter type, which would be office visit. And then you have to choose this second one. You've documented their medications. If you provided them with any educational explanations, you add the care plan. We have standard care plans that we've developed over the years. And Dr. I can always give you a link to that, and you type it here. Type care plan here. The patient can see the care plan online, and they can also see their diagnosis online too, as well as their meds. If it's a brand new patient, you have to put incoming transfusion here, and then you reconcile their meds. That's only for brand new patients. And then for meaningful use and physician quality reporting, you're required to add some intervention and assessment. Typically it's for tobacco. If you type in tobacco, you see tobacco counseling. Smoking and tobacco, yeah, they smoke positive, and you probably advise them to quit or provide them with Chantix and stuff, or Wellbutrin and so on. And then you add one for overweight. You add BMI above normal. And the reason is a patient is overweight, and you've asked them to exercise and diet, or send them to the weight management clinic. And then there is depression screening too. Add depression screening. Adult depression screening. If it was positive, you click it's positive. And what you plan to do about it, maybe not just physical treatment with meds, but also psychologic, CBT, cognitive behavioral therapy, social work referral, and so on. And then you save. Please do not sign any notes. Save. And basically you're done with the note, but the other option you have really is to also do some of the past medical history here. Under past medical history, you would see that you type previous psych treatments, what medications they failed, any hospitalizations, any suicide attempts. You put the allergies, ongoing medical problems, medications. Medications like propranolol can cause depression, or sexual issues too, some beta blockers. So they are relevant. Treatment for thyroid and so on. A relevant family history, which is a biologic marker for heritability.